We are now live.
Good morning, everybody. We'll call this meeting to order.
Morning.
I would ask, looks like we've got all but one member present, so I would ask for any disclosures of pecuniary interest. I'm not seeing any. And with that, we will look to Dr. Ronaday, I believe, who's going to join us for an update on the COVID-19 situation. Dr. Ronaday, if you would be so kind as to take it away, please.
Preemptively, but let me just make sure you can hear me. How's that?
That's good.
Oh, okay, great, good, thank you. So I'm just going to make a request for the host to enable me to share my screen with you. And in the meantime, I'll just do a little bit of an update and then go to something that I wanted to connect with you folks on. So the update is, you know, really, we're seeing cases here and there. I would characterize what's going on right now as sort of grumbling. The outbreak is sort of grumbling along. We get cases here and there. We're up to 336 with 299 recoveries. What we found is that most of the cases that we've had in the last little while have been connected all to each other through gatherings or through a workplace or through close contacts with other people. There are two questions that were asked for me to bring to this meeting. And so one of them was, what percentage of COVID cases are we seeing from community transmission? There's no real definition for community transmission. So really, I think the question is, what percentage of cases are we seeing outside of places where we can connect sources of exposure? So for the last few weeks, I think there's only been one case out of all of the set that we've not quite figured out what was the source of exposure, but for the most part, it's close contacts and known outbreaks. That's consistent with what we've seen over the course of this outbreak, where if you look at our data on Lambton Public Health's website, it's about 75 to 80% of cases are traced back to either household or close contacts or in the context of a known outbreak. The other question that came in was, what's the progression that we're seeing in the severity of cases? They seem to be less severe, the ones that are happening now. Why is that? There seem to be fewer hospitalizations and so forth. And the answer to that is that there are probably two answers. One of them, or two ideas about why that's happening. One, we won't know for sure, and the other one we can be fairly sure about. The one we don't know for sure is that there's this idea going around that there might be multiple strains of the virus, and that one of the strains that has become more dominant is a less aggressive, less severe strain, while the ones that are more severe are less aggressive or easier to identify and stamp out, right? That, unfortunately, that's not an answer that I can give you. That requires some genetic and molecular testing on the different strains. And so when we have a provincial call, we have them a few times a week, I think, and the public health labs are represented, I'll bring up that question to them and see if there's any efforts underway to do sort of overall strain typing to see if there are differences between what we're seeing now compared to what we saw earlier on in February and March. The other piece that we're more certain about, though, is that in general, so across the province and in Ontario, the folks who are getting COVID-19 in this next sort of round, I wouldn't really call it a wave yet, but the next round, are in a lower risk category. So because primarily they're in the 20 to 49 age group, many of them are less likely to have hospitalization or severe outcomes from disease. And so that's the one that we know. The piece that we don't know is whether or not there's a different kind of strain moving around, and that requires the lab to do some analysis. So with that, if you'll allow me to just share my screen for 2 minutes. Let me see if I can do this. Can you all see that? Okay, good. So this is very, very short. I just wanted to give you kind of a high level overview of like where we were and where probably we're going. I'm calling it moving the goalpost on COVID response because I think how we need to consider this compared to how we were considering it in February, March, it needs to shift a little bit. And that shift is happening slowly. I just want to kind of inform you about it and tell you where it's going to go to the extent that I can. Remember, the early COVID goals were contain and protect. You saw a lot of closures of spaces, lots of prohibitions around interactions and things like that, protections around long-term care homes and other vulnerable groups while we tried to improve our testing capacity. And the early days of this were really learning and understanding, right? So we started to recognize expanded vulnerabilities, both in people as well as in our systems, trying to really pin down the disease transmission pathways. And we know now that it's largely droplet transmission and that there's less thought that surfaces, et cetera, are as high risk as we thought that they were early on. And recognition of key transmission settings, healthcare, personal service, and close contacts. I think our longer range COVID goals, right? The full closure of society is unsustainable. But a full return to everything we used to do is also not sustainable from a disease management perspective. So it's about getting a balance, balancing protections with opening societies, reviewing responses in other places to find out what works, what doesn't work, and why, and have as much of our society function as normally and as safely as possible, which is important to recognize is not a zero risk proposition, right? There will be cases, there will be there will be ongoing incidents of COVID-19, and it's about keeping it at a manageable level as opposed to having it be zero or having it be overwhelming. And use what we know to try to maybe shift our goals away from preventing all transmission and toward keeping transmission manageable, protecting vulnerable people, and preventing severe outcomes like hospitalization and death. So if you think about how we know that COVID is spread, we know that one of the primary drivers is within your household. So 78 to 85% of transmission from over 75,000 cases in China were identified as household contacts, household transmission. The next level of risk is close contact, people you share meals with, communities, faith groups, healthcare, personal service, so where the contact is very close and of long duration. And then finally, there's casual contact, limited duration, which is thought to be of low risk. I think it's important to think through moving towards a more comprehensive approach to COVID, which is to think about interventions at different levels by risk and contact level. So for universal interventions, things that everyone is expected to do, physical distancing, hand hygiene and respiratory etiquette, isolating yourself when you're ill, and the use of masks when you cannot physically distance. Those are important for everyone, and I think we need to start adding in some targeted interventions for high-risk folks when the prevalence goes up of disease. So in the UK, they had this concept called shielding or cocooning, which was to take people of known high risk and enable them to isolate themselves with social and clinical support. So we may need to look at things like that as the prevalence of disease goes up. And then also to strengthen and carry on with our case and contact identification and management. So far, we're meeting all of the benchmarks related to that. But again, they're looking in terms of the whole system at what's the capacity to do that if we become overwhelmed with cases. And then finally, the last several things are just things that we have to keep on our radar, things that we're in public health making sure that we kind of explore as new data become available. One is, what's the true prevalence of asymptomatic infection? One is there a possibility for reinfection, and what's the duration of immunity after you get the disease? Right now, there's some early indications that there's some pretty strong immunity after you get natural disease, but again, we have to see that play out and basically have more experience with this disease. What are the transmission dynamics in children, especially those under 10? There's lots of evidence out there that children under 10 do not transmit disease in the same way that children over 10 do. It's unclear as to why that is, but certainly in most of the outbreaks that have been in schools with young children, children were more likely to have gotten the disease from their household contacts than they were to have gotten it from other children or in the school environment. There's lots of work on vaccines. Of course, you're probably keeping up to date on that. And then there has been a number of new tests approved by Health Canada recently. None of them are yet in the category of what I would call game changers for how we approach testing, but they're getting there. So a game-changing test would be one that was rapid, reliable, high volume, and didn't really require the use of a lab to perform a validated test so that you could do it on site with minimal equipment. We're not there yet, but there are some interesting testing developments for point of care tests that are being piloted in, there's one being piloted in a mine in Rainy River and some other places. And then finally, the biggest priority we have right now is the planning for the fall in the healthcare system and the education system. The opening of schools presents a number of significant challenges that we're working with the school boards to work through, given the direction that's coming from the Ministry of Education about how they're supposed to run schools. And then in terms of the health sector, we've had active conversations around reformatting what the assessment centers look like to incorporate, fall season coughs and colds and flus, many of which will not be COVID-19, but in order to assess them, you have to have the right PPE and all of the equipment to rule out COVID-19. So you basically need to be able to do a test at the same time as you need to be able to assess the respiratory illness. So there's ongoing discussions within the Ontario Health Team Group, the health system group rather, with regards to how to reframe the assessment centers to make them more sustainable and to handle that load in the fall. I think that's all that I have, so I'm going to stop and hopefully you can see me again.
Yes.
Okay.
Okay, well, thank you for that. I will look to members of this committee for any questions or comments for you. I see Councillor Napper, followed by Councillor Bradley. Councillor Napper, you are on mute, sir. Lonnie, you're on mute. Try one more time there, Councillor Napper, to unmute. Are we able to unmute Councillor Napper at the host?
There you go. How's that now?
Yeah, that's perfect.
On the weekend, I got a lot of calls about gatherings of young people in the park, and it looks like moving forward, these are going to be the carriers of this disease. What's your group doing there? They don't social distance. They don't do nothing. I've seen a lot of that, and it seems that's where the trend's going. And they're not going to have COVID. They're going to have a good case of the flu. What's in store there? Don't you think it's time we had mandatory masking for folks like that?
So I think the questions are sort of separate because I'm not sure that mandatory masking would address the issue of young people gathering. Many of them are gathering in private spaces or in open spaces, and so it wouldn't really affect that materially. So let me take them as two questions. I think we know that one, people are definitely experiencing COVID fatigue. People are definitely experiencing the lack of social interaction, and they want to get that back as much as possible. There are still rules for gatherings in place, but I'm not sure that they would touch on those gatherings because the rules are now 50, 100, etc., not 10, 5, where it used to be, right? And so I think, if the prevalence of disease starts to go up, then I think there will certainly be forces either from the province or even locally that would say maybe we need to bring that gathering limit down again. When people are in their private spaces and hanging out together, it's hard to control that kind of behavior. And so then what you have to move to is sort of shifting the culture, more health promotion stuff. So we've been sharing messages from the province around how important it is to maintain your social circle and stay in that. But that is a hard message to get across. And I think we can continue to do whatever we can to promote it and to ask of it. But how people behave in those settings is still going to carry on, right? And there's only so much that you can do about those gatherings. So I think we can keep working on it. We can keep driving that message forward. But at the same time, and it's not just young people, I would say, because in many other places where they're seeing resurgences of disease, it is through private gatherings or family gatherings. And so these are the things that people want to get back into, but it's hard to do that safely because you're going to want to connect with your people and not keep physical distance. So physical distancing is still the primary driver, right? We want people to do that and keep away from each other, but it's a hard message to keep selling. People are getting a little tired of it.
Oh, I lost them altogether now.
Oh, sorry. Did everyone?
We heard you.
Oh, okay.
Lonnie, are you with us?
No.
Yep. No, can't hear us.
Okay, I'll come back to Councillor Napper in a moment.
I'm back.
Oh, you're with us. Okay, great. So I know
Yeah,
there was
no,
your question as well.
it's a different ballgame. I understand what you're saying there, but we have no control over these people. They're going out. Their parents don't know where they are. They're going home, and I just think it's time now that maybe we got to step up the plate here and do something. I don't know what the answers are, but thank you very much. Yeah, I'm done.
Okay. Thank you, Councillor Napper. Councillor Bradley was next.
I have two questions to the doctor. I just want to make sure, maybe I didn't understand correctly what you said earlier in this broadcast. You said there might be a milder form of the virus, but you don't have any evidence. Is that what I heard? Is that what you said?
So there's some idea that there are these multiple strains of the virus, right? And that the virus, because the virus does continually mutate, there have been many different strains that have been documented over the course of the pandemic. What is unknown is whether or not those strains are materially different from each other and whether or not they cause materially different kinds of disease. So one of the ideas that's been floating around is that because we're seeing fewer deaths and hospitalizations in the recent upsurge of cases, that perhaps it's a different kind of strain that is dominant. In order to establish whether that's true, you need to run genetic testing on the virus samples that are coming through, which needs to be done from the labs. So what I suggested was that at the next call that I have where the labs are represented, I can ask them that question to see if they are doing any strain typing. But the other possibility as to why there are fewer hospitalizations and deaths is because the population that's being affected with this sort of resurgence of COVID is different and is less likely to suffer from severe illness.
Okay. Second question is related to the city primary control group met with the school board last week, the public board, and I believe we're meeting at 9:30 with the private board, the separate board. I noted in Toronto, the public health organization has put together a rapid response group of nurses, veteran nurses, new nurses, to respond when the schools open, not just education, but to respond to deal with the situations in the schools that will develop, and we know will develop. So I'm asking, is public health in Lambton looking at a rapid response team? And I'm seeing your letter and the other letter from the Chatham Kent Medical Officer of Health, but I'm more concerned when school opens, and it's the number one issue out there right now in the communities, is will public health be on top of dealing with the situations that are going to develop in the different schools in a rapid manner as it happens?
Yeah, I mean, I think so. A couple of things. One, there was some new funding announced for us to be able to do that. And so we're waiting for specific details on that funding. But having said that, we are planning to boost our response capabilities with respect to schools because of that funding. But also outside of that, there are, I think that the key piece is early outbreak identification and management. And so we're looking to build a system to be able to do that.
Thank you.
Thank you. Any other questions from committee members? Looks like that's it. So thank you, Dr. Renaday, for today's update. We appreciate your time as always. And we'll look forward to seeing you, I believe, at County Council in a few weeks.
Okay, thanks.
Great, thank you. Okay, moving on to infrastructure and development services. We have one letter here under section A, correspondence to receive and file. May I have a motion? Looks like Councillor Veen, Councillor Ferguson seconds that. Any discussion? All in favor? That is passed. Under section B, we have correspondence from members from a member municipality, just one letter from Petrolia. I'll look for a motion to receive that. Deputy Warden makes the motion. Councillor Bean seconds that. And any discussion? Councillor Bradley.
I think we should be endorsing this motion from Petrolia. Receiving and filing doesn't do that, unless I misunderstood what the mover and seconder were trying to achieve.
Okay. Will our mover and seconder agree to endorse this letter? I maybe miscalled that one. That looks like a yes. Yes. Okay. So this is an endorsement.
And I would like then to add an amendment, and perhaps Councillor Bird would support it, since he's been involved in this drainage issue. We've talked about a review of the Drainage Act across the province. We've had, Councillor White, you would know this, we've had issues within the city on drainage, and we've got that urban rural mix here. So I think we should not only endorse this, but also ask the province to review the Drainage Act. It has not been reviewed, as I understand correctly, for quite some time.
Okay. I will take that as a motion to amend. Anyone willing to second that amendment? Councillor Bird. Councillor Bean, discussion?
Yes, thank you, Mr. Chair. I believe it's time that we should look at this as well. Dealing with the drainage here in the last couple of days with the St. Clair Conservation, we do have some issues there, and I believe it's time that they take a look at the whole organization.
Okay. Anyone else? Warden Weaver.
Yeah, just I guess a comment. I'm wondering how this has to do with a development or a development project. And I know that development projects operate under a stormwater management plan, and some of that is outside of the Drainage Act. That's up to the developer to develop that. So is this two different things, whether it's the Drainage Act for agriculture drain, or when there's a development in a town, there's a stormwater management plan that has to be engineered and adopted, and that can be enclosed drains or open drains. So are we, whether Mr. Cole is, I guess that's what I'd like clarification on. Whether the Drainage Act should be used for a development and a development agreement with in a plan of subdivision.
Okay, Mr. Cole, any comment on that?
Yeah, I mean, we see that done both ways, where you know, subdivisions are manage their drainage through the municipal drain system, or through a directed municipality system. Certainly, the inability to enclose a drain through a subdivision development makes that decision from the developer's perspective more difficult, because they're not able to, use just easements to contain it underground, and what they want the development to look nice. Really how that policy is applied is something that's handled at the Conservation Authority, and if we're not happy with that, then we certainly have the opportunity to voice that concern.
Okay, thank you, sir. Any other comments or questions? Councillor Ferguson?
It opened up the Drainage Act would be a massive undertaking. I think really we want to direct ourselves to the St. Clair Region Conservation Authority. And there was, at the last meeting, I think this topic was discussed. As farms get bigger, and when you do things in town, the farm equipment now, we need to cover some of these drains over without being pushed back by the Conservation Authority. And the drains covered over, they're not big, massive drains. They're smaller. You put cement tile into them. The Drainage Act is a massive program. You have to be careful what we ask for on that part. The Conservation Authority side of things is the direction we should be going for.
Councillor Marriott, or Deputy Warden Marriott, and then Councillor Bradley.
Yeah, I'd just like to echo Councillor Ferguson's comments. Those are dead on. The problems that we're having are with the Conservation Authority, and I agree. Asking for an update on the Drainage Act, although it's not perfect, still covers things really well considering how old it is. And I agree with Dave that careful what we ask for there, because we could end up with stuff that we really don't want changed.
Okay, Councillor Bradley, follow up.
The last, my further comments of Mayor Ferguson and Mayor Marriott. So I'll make it simple. Split the question, endorse the Petrolia resolution, and then we'll deal with the drainage act separately because there seems to be some valid concerns raised. So let's make it simple.
Okay,
Just two questions.
we'll split the question. We'll go back to the original motion to endorse the letter. Any other further discussion on that? I see none. All in favor? That is passed. And now to the second question. And again, Councillor Bradley, if you wouldn't mind just clarifying now the question for me.
I would simply that we request the Province do a review of the Drainage Act. It may stay the same. I do know that, at least I've witnessed in this area, some serious issues we're running into with it, and it has not been changed for some time. And again, it may just be the status quo, but I do think it's time. I don't think it's been amended in any great form for some time.
Mhm.
That's all. It's a request to do it, and obviously we would have input on that.
Okay, and Councillor Berg, do you still second that?
I do, yes.
Okay. Any other comments on that issue or questions? I see none, so we'll go to vote on that. All in favor of the question? Councillor Marriott, are you shyly voting for? No, you are withholding your vote on that. Okay, so it looked like 3. Okay, so let's just be clear on that one then. I'll call the roll, or I'll ask staff to call the roll, please, Mr. Tifo.
Thank you very much. I'll just go in order, alphabetical order. Councillor Bird,
Yes.
Councillor Bradley,
Yes.
Councillor Ferguson,
No.
thank you. Deputy Warden Marriott,
No.
thank you. Councillor Miller,
No.
thank you. Councillor Napper,
No.
thank you. Councillor Veen,
Yes.
thank you. Councillor White,
Yes.
and then Warden Weaver.
No.
That fails.
Okay, thank you. And moving on to Section C, information reports. 1, 2, 3. We have 3 information reports. Look for a motion to receive all 3 of those, please. And that is Councillor Miller, seconded by Councillor Bradley. Any discussion on any of those reports? Councillor Bradley.
I would like to ask that we endorse the 2 motions that relates to guaranteed income and changing the CERB, based on the fact that County Council has endorsed similar type directions in the past.
Okay. So I will take this motion then to receive these information reports, and then I will go back and look for a second motion to endorse those 2 letters, if that makes any sense.
I'm sorry, I may have jumped ahead there.
Okay. And I apologize, I'm running out of data today, so I've got very limited screen space, so I'm having a hard time keeping up as well. So A, B, and C.
I'm going to withdraw that. Just leave it as it is.
Okay, thank you. So all in favor of receiving these reports? That is passed. Okay, now reports requiring a motion. We have 4 here, so I will go through these one at a time. Councillor Bird?
Thank you. So through the chair to the warden and council, I would just ask, before we start this section, as they all require motions, I'd like to ask that item D be deferred until our next full county council meeting on September 2nd, because this very important topic has always been discussed before a full county council. And before any further discussions take place or motions passed, it is critical that the entire full council continues to weigh in on the future of this matter. Thank you.
Okay, it would have been my understanding that this would go back to county council anyway. Is that correct?
As far as I understand, through the chair, I'm just concerned because it's requiring a motion. So I don't want a motion and discussion taken place by only half of council when it has always been discussed in front of the whole full council.
Okay, So by way of the minutes, this will be received at County Council, and we're certainly welcome to withdraw and discuss those items at that time. Am I correct to assume that this would still require a County Council endorsement, Mr. Tifo?
Yes, correct. So the rules are currently, the process is you debate it here, you roll up your sleeves at committee, you make a recommendation to county council, and your minutes are forwarded to county council, and it's effectively a consent agenda, meaning that any item from those minutes can be pulled for further discussion at county council. But if I understand Councillor Bird's preference at this point in time, is that the full debate be had one time originally at county council. I think that's
right.
The question is.
Okay, and that is reasonable of a request, I imagine, for everybody. I will make that call then. So we will remove item D regarding the waste management master plan to have the full debate at county council. That is reasonable. So we will stick with items A, B, and C one at a time. So item A, report regarding tourism-oriented directional signing agreement. There is an attached motion to that. Do I have a mover for that? Councillor Ferguson, do I have a seconder for that? Councillor Bird, any discussion? Councillor Ferguson?
Just a quick question on the $150. That's over the course of the years per sign, over the 10 years, or per year per sign?
Cool.
Through you, Mr. Chair, that would be per review. So whenever they need to put a sign up, we get $150 to review the location and the placement of that sign.
Thank you.
And that is just a slight offset to the staff cost for that one particular service, right? Okay. All right. All in favor of that motion to extend that agreement? That looks to be mandated. All in favor. Okay, it's passed. All right, I'm split to 3 different devices here. Bear with me. Item B, the road widening dedications along various county roads. There is an attached motion to accept that. Councillor Napper, Councillor Bean seconds. Any discussion? All in favor? And that is passed. And item C, County of Middlesex Winter Maintenance Agreement Report. There's an attached motion to continue on with that agreement. Do I have a mover? Warden Weaver. A seconder? Councillor Ferguson. Any discussion on that? Councillor Ferguson, is that for discussion? Nope. Okay. Councillor Napper, discussion?
Yeah, is there any opportunity? I know there's different county roads within the county that that same thing could apply there to the municipalities, maybe? Have you ever looked at those roads?
Through you, Mr. Warden, Matt DeLines here. He knows what roads we have agreements with the local municipalities. Matt, can you help fill in that blank?
Yeah, through the chair. We have several St. Clair Township roads that we have agreements with. From 40 Highway west to the St. Clair Parkway, County Road 1, County Road 28, County Road 36 are all maintained under agreements with St. Clair Township. County Road 15, south of Rutherford to the county line, is maintained by Don Euphemia. So we do have annual agreements with local municipalities to maintain sections of county road where it makes sense from a logistics standpoint.
Thank you. Any other further discussion on that? Seeing none, all in favor? That is passed. Okay. And is there any other business to members of the committee or staff? Seeing none, and we're moving on to public health. Thanks, Matt. Thanks, Jason. Okay, we have under section A, 1, 2, 3, 4 items to receive and file. Look for a motion to receive all 4. Warden Weaver, Deputy Warden Marriott seconds that. Any discussion? All in favor of receiving these? That is passed. Thank you. And we have 5 information reports, A to E. Looking to receive those. Councillor Veen, Councillor Miller seconds that. Any discussion? I see none. All in favor? And is there any other business for public health? To staff to chime in if necessary. Mr. Taylor?
Good morning, Council White. Just one item under other business, and the question was surfaced by Councillor Bradley. Just an update. We provided an activities report in this package, and what we didn't include was the funding that the province has announced for new nurses to support the province's plan for the safe reopening of schools in the fall. So just a heads up to say that, as Dr. Ronaday mentioned this morning, we are awaiting more details, but public health has been required to actively proceed to recruit staff so that there's visibility in the schools when they reopen in the fall. So I just wanted to make council aware of that. And once we proceed through that plan, we'll report further to county council, probably the September committee meeting.
Okay, so thank you for that. So just for clarification, all of the nurses that will be supporting the school reopening in the schools will be working through Lambton Public Health. Is that correct?
That's correct. This funding is directed to boards of health. So the staff will be those of the health department, and all those resources will be directed through us to the schools. That's correct.
Okay, thank you for that. Any other business from members of the committee? Public health, I see none. So we are moving on to cultural services. Under section A, we have 1, 2 reports to receive and file. So look for a motion to receive items A and B. Councillor Veen makes the motion. Councillor Ferguson seconds that. Any discussion on those 2 reports? I see none. All in favor? Yes, sir.
I'd just like to make a comment and kudos to staff for putting this together. It takes a lot of work to get those that number of places ready to be opened, and staff did a great job, and looking forward to having this back in service. So thanks to them.
Great, thank you for that. And on that question, it was passed to receive those 2 letters. Information reports under section B, items A and B regarding the reopening and libraries, stats. I'll look to committee to make a motion to receive those reports. Warden Weaver and Councillor Napper seconds that. Any further?
Yes, my comments were a little bit ahead of where we were, but that's what I thought we were doing. So
that's all right. All right, or you caught me, however that works. Councillor Napper, you're on mute. The most common days of 2020, you're on mute.
How am I doing now?
You're doing just fine.
Oh, is all the folks that were deployed to other positions through culture services back to their normal jobs yet?
Mr. Meyer.
Through you, Mr. Chair, yes, effective in September, as early as September, we will see most of those who have been redeployed to other sites return to their normal positions within cultural services. Right now, we do still have some staff that remain on indefinite layoff that are not returning until our facilities reopen. So they are continuing to support primarily long-term care with the screening efforts.
Okay. Any further questions on that? No. Okay. We'll call the question. All in favor? And those reports are received. Any other business for cultural services? Seeing none. All right. Thank you, Mr. Meyer. As always, we appreciate your time and efforts on that. Those great reports. Moving on to corporate services. We have 2 reports requiring a motion, so we'll keep those separate. Item A, amendments to procedural bylaw number 33 of 2014 regarding the electronic meetings. I'll look, perhaps Mr. Tifo, would you care to actually offer anything up front on that?
Yes, thank you very much for the opportunity. I'll keep my comments brief. Really 4 points to make. Prior to 2016, 2017, so prior to Bill 68, there was no opportunities for councils and or its committees to meet electronically. 2, Bill 68 then amended the legislation, namely the Municipal Act, and allowed for electronic participation for open session meetings only, not for closed session meetings. But if you participated under that legislation electronically, you didn't count as for quorum. And of course, thirdly, we got the pandemic that hit us back in March, and the province amended the Municipal Act to allow for these electronic meetings, but only during a declared emergency, either a declared emergency by the province and or the municipality. Now with the Recovery Act, Bill 197, that was passed back in late July, you can amend your procedural bylaws to allow for electronic meetings, much as we've been doing for the last 3, 4 months or 5 months now. Under any circumstances. It does not need to be restricted to moments when there's a declared emergency. So the report effectively says that, and the report effectively gives you language to amend your procedural bylaw to allow for the continuation and or use of electronic meetings in the future for effectively any purposes that the warden, the chair of the county council decides. So that's simply it. Short little history, where we were, where we're hoping to get to.
Okay, thank you. Let's see, should we do questions or should we put this on the floor first? Let's put this on the floor. I'll look for a motion to put this on the floor. Councillor Veen makes the motion. Councillor Ferguson seconds that. Okay, we'll go to questions now. Warden Weaver?
Just a clarification. If we pass this, and does that allow a mixture of both? So if a councillor just says, no, I'm going to stay home today on the couch, the meeting is held in person at the council chambers when it opens up, but I'm going to do it electronically. Is that allowed? Like it's either a electronic meeting or it's a in-person meeting. There isn't a mixture of the two, is there? Or how does that, can you clarify that for me?
All right, so 2 responses to that, or 2 reactions. 1, the legislation would allows, and then 2, what we're doing through this report. The legislation, if you were to allow it and amend your procedural bylaws accordingly, could permit a full council meeting to be fully online, fully electronically, or you could permit any individual members of council or committees to participate electronically while others are participating in person. That's what the law allows, but that's not what this report or these amendments would do. And the reason for that is back in late November 2017, this issue was already before council, i.e. to allow individual members to participate electronically. Council shot that down. So the report here, being my second reaction, is that it would be all or nothing. All of committee or all of council will participate electronically. There would be no opportunity for individuals to elect to participate electronically while the rest of committee or council is meeting in person. If you wished to extend that right for individual members to participate electronically, I added some language in the report, but you'd have to specifically pull that out and ask that it be included in your procedural bylaw. Right now, it's not included.
Thank you.
Okay, so that makes that pretty clear. Thank you for that question. I had the same question, so that's clear, I think, for everybody. Any other questions regarding the motion as presented? I see none. So I will call the question. All in favor of this, these amendments? That looks to be unanimous as far as everybody on the screen goes. So that's definitely passed. Councilor Bradley, did you want to register your vote on that?
Yeah, I'm sorry, I'm trying to do two things here, which I shouldn't be. We have a primary control group on Wednesdays. It's the only one we have, so I have to participate in that.
That's okay.
My apologies. Am I understanding correctly that you're moving forward on the recommendations on that Mr. Tebow has put forward?
Yeah, sorry, that did break up. I apologize as well. So your question again, sir?
It's just that you are moving forward on what Mr. Tebow is proposing for amendments? Okay.
Yes. Yeah.
And this would all be subject to the emergency order, correct?
So no, that changes a bit. Now, back in March, they amended the municipal legislation to allow for these electronic meetings and to be counted towards quorum, both in open session and closed session, while there's a declared emergency. The new amendments to the legislation through the recovery legislation allows you to meet electronically without there being an underlying declaration of emergency. So these amendments would open that flexibility for council to meet electronically, despite there not being an overarching declaration of emergency. But again, it's all or nothing, meaning all of council, no individual members can select to choose to participate electronically while the rest of council is meeting in person.
And again, I apologize for coming so late in the game. So, for example, we've had a couple of occasions when there's been some pretty massive snowstorms. And, you know, there was a debate back and forth about to proceed. So this would deal with those type of situations. It wouldn't just become the convenience of, you know, being at home on the sofa and okay. I'm fine. I support what you're doing. Thank you.
Okay. Thank you. Good questions there. Appreciate that. And finally, we have a report regarding the procedural bylaw 33/2014 regarding the proxy votes, just some amendments to that. Do I have a mover for the recommendations? Councilor Miller, do I have a seconder? Councilor Ferguson, any discussion on that? Councilor Bradley.
Mr. Tebow, and then again, just exactly what will this mean?
Yeah, good question. So before I answer that, I want to put it in context now in terms of council participation in council meetings and or committee meetings. Rewind 5 years, you had one option, which was to show up. And then, of course, as we've just explained, you now have an option as a whole, as a committee and or council to participate electronically to deal with some of those situations that arise where meeting in person is difficult, if not impossible. Then, of course, in Bill 68 back in 17, they amended the legislation to allow for the appointment of alternate members. In this council, meaning Lambton County Council, 9 of our municipalities have appointed alternate members, i.e. individuals cannot participate. They can send their alternate members to county council on their behalf. 9 of the 11 municipalities have that. In addition to these now new flexible, more broader rules in terms of participation in council, the province now recently added a new option, which is the proxy vote. And if you were to move forward, and I'll just speak to the impact of this at county council because it's a little bit different on at the local level. But at county council, you can appoint, if you have a if you have a member of the same local municipality also here at county council, you can appoint that member as your proxy in the event that you're unable to attend a meeting. And if you do appoint that person as your proxy, then he or she speaks on your behalf. For county council, that is really only beneficial at this point in time for 11 of the local municipalities, because again, you have to have a member that originates from your municipality to qualify as your potential proxy. So again, 3 out of the 11 municipalities would be able to benefit from that. If you were to move forward, those 3 of the 11 municipalities could nominate one of their co-local municipal member as their proxy, and that proxy would act as effectively the agent of that council member. There's a number of issues that come up with that. Obviously, there's the notification obligation, i.e. notification to us so that we can prepare for the meeting. That's why there's that protocol that was attached. And effectively, the protocol says, you know, for a proxy to act as a proxy, they need to advise the clerk in advance, or the proxy would advise the clerk in advance of the meeting, and you move forward on that basis. So effectively, it's just a separate option that's available to you. I just wanted to put that in a report for your consideration. And of course, it's something that you may want to look at the local level as well, because at the local level, then you can obviously appoint any one of your local members as a potential proxy. It's just here because we have 8 of our 11 municipalities only have 1 member from the municipality. They don't have an option for a proxy. I'll take any other questions. It can get a little bit more convoluted. There are practical considerations behind the scenes that I think individual councillors will need to necessarily have a bit of a heads up on before they appoint proxies.
Okay. So to clarify then, the recommendations in here then allows for this council to do what then specifically? And I apologize, there's a lot to digest in all of that.
There is, if you were to move, and then I'm not making a recommendation. And I say that in the report. All I'm saying is that this is your option. This is truly your decision. It's just the subject heading of the format of the report. Again, if you were to move forward, you would provide 3 of your 11 local municipalities, being Sarnia, Lambton Shores, St. Clair, members of county council, the option, the ability to appoint a proxy for them to vote for them at county council in the event that one of those members cannot make a county council meeting. That would be in addition to if we had a situation about participating electronically, and in addition to already your alternate members being nominated by your local municipalities. The difference between an alternate member and a proxy in terms of the law, the alternate member is appointed by local councils. So before you can have an alternate member for any one of your members of county council, your local council makes that appointment. In a proxy situation, it's the individual member who says, Bob, can you vote for me at the next meeting, right? There's a procedure to be followed, but nonetheless, it's that. There are practical political considerations in that, one of which is, one, ensuring that there's no division of loyalty where for that council member. Obviously, conflicts of interest. You can't do indirectly what you can't do directly. So you can't appoint a proxy to vote on something that you're not eligible to vote. So that could trip up a few individuals. And then there's the notion of, well, if you're nominating a proxy, or if you're appointing a proxy, prior to a debate, because obviously you're instructing that person to vote one way or another on an issue, are you open to debate? Are you open to changing minds? Are you open to that? So again, I'm not making any recommendations. It's something that I put on your lap because it is your rules. It's, in my mind, mostly an individual councillor member political consideration as to whether or not you wish to open up that flexibility for nominating proxies.
Okay, thanks for making that more clear. Councillor Bradley, question?
I'm thinking this is the sort of thing we just leave alone because I'm not seeing the value to it. But I just think about our situation. We have 5 county councillors, including myself. We have appointed a local councillor, and it would seem to me if I decided I wanted to have a proxy and appoint someone else, or Councillor White did or someone else, it seems to me I'm trying to bypass the local council in our situation. And the second thing is, I've always had the philosophy ever since I've been there in '91, if I'm not, well, in this case, if someone's out there representing the city, we don't tell them how to vote. You're out there, you're not there going, okay, you told me to do this, this, and this. I just think we leave this alone. I don't see the issue. I'm glad you brought it to our attention, but I don't see why we even want to go down this road. We do have a backup system in most of our councils. I just, at this point, think just leave it alone.
Yeah. If I may indulge just for a moment, I would agree with everything you just said, Councillor Bradley. This feels incredibly inequitable and unfair, but that's just me throwing in my 2 cents. But the motion was made. I certainly don't take that as an endorsement on anybody's behalf, but good discussion on that. Is there anything else from any member of the committee? Councillor Ferguson?
No, it's only affecting 3 councils. It does not affect what I call the rural side. So I'm in effect voting on their behalf to put this motion through. I'm speaking against this particular motion. this does not involve me, and I have a second person in place if I cannot show up, same as Sarnia.
Okay, thank you. Any other discussion? Okay, we'll call the question. All in favor? And that, well, all opposed. Opposed? That looks, and I'll include myself in that, and that is unanimous. That motion is defeated. Thank you, everybody. We have no in-camera reports, so that will wrap us for today. So look for a motion to adjourn. Councillor Veen, Warden Weaver seconds that. All in favor? Thank you, everybody. Thank you, staff. Have a great rest of your summer, and we'll see you in a few weeks.
Thank you.
Stay safe, everybody.
Bye now.
Bye.